Okay, me too.
Welcome to EMS Today in Washington, D.C. and the National Academy's Transportation Research Board EMS Safety ANB 10.5 Subcommittee. We're embarking upon a fairly global exercise right now to share some fleet management tools in EMS in a web seminar. Now, for those of you who want to share information on Twitter, our hashtag is #EMSFleet. We are very, very fortunate to have AJ Heitman with us right now, who's going to actually do the opening address. And I know you all know AJ. But I'm going to do a formal introduction. AJ is the editor of GEMS magazine.
We'll go over to a slide in a second, but just by way of background, I actually grew up in Scranton, Pennsylvania, and at the age of 10 was snuck along on ambulances with my dad, who was in the fire department. And you know, I'm really pleased to be a part of this webcast because safety has always been pretty important to me. And just by way of background, my dad retired from the fire department, but before he did, he spent 35 years there, was very safety conscious and always had his people wearing white uniforms. And he groomed everybody to go into their next position, including his replacement. And a young lieutenant got promoted to captain to take his place. And the fire chief decided that he wanted them to wear all dress blues, dark blue uniforms. And about 2 months after my dad retired and this gentleman took over, he in full dress blues was running across a highway to assist a patient from a mental institution that had jumped off a bridge. And he was struck by a vehicle who didn't see him on the highway and killed. So my dad had invested 5 to 6 years of training his replacement, and he was killed in an instant by a very unsafe principal. So, you know, safety's always been something that's a big concern of mine, and particularly with fleet maintenance, I think the thing that's key for me, and we used to run a fleet maintenance conference through GEMS, and it always was the important thing that, you know, if you can't get there, you can't help the patient. So your vehicle safety and all of those particular procedures are really important. We reported on a story about a week ago about a person who got in an ambulance and was responding to a call in the ambulance. The ambulance had been actually cited by their Department of Health as having a bald tire, and that vehicle was supposed to be put out of service, and the procedure was that it had to be out of service within 48 hours, but nobody told him he was driving on a bald tire, and the vehicle rolled over and he was killed and the patient was killed. So these things continue to annoy me because as Gordon Graham, the famous lecturer on safety, talks about, is predictable is preventable. So anything that we can do through the academies and through these kind of webcasts to me are extremely important. So Nadine, good luck with the webcast, and hello to everybody from EMS Today. It's snowy here, but the show goes on and we have great attendance.
Thank you so much, AJ. Well, that was a photograph of AJ taken at last year's EMS Today, where AJ supported us in having our big summit, which many thousands of people, over 20,000 people, have downloaded that information. So I'm so pleased that we've got an opportunity to yet again be at EMS Today and to have AJ open our event today. So moving right along, this is what we're going to cover today: an overview of the TRB and ANB 10.5, a review, I must have made that slide when I was a bit tired, review of ANB 10.5's EMS fleet activities, and then we're going to move into a fleet management tools update. We're going to have an introductory presentation by Nancy Ben-Dixon from AON, and then we're going to have a couple of operational presentations from operational EMS folks who you're going to hear about in a little moment. So really, a lot is now possible and for a lot less. We now have tools at our disposal that are going to assist us in driver behaviour management, vehicle behaviour management, roadside intelligent technologies, improved fuel consumption economics, and resource modelling. And how deploying technology tools that our presenters are going to discuss, particularly some in-vehicle telematics, as well as some smartphone telematics. Is that a new member joining us? Welcome, Ronald Rolfson. I see you've joined us from Norway there. Slides are a little slow moving forward, so I apologise for that. It may well be the internet connection that we have here. And as they had, even a year ago in Wired Magazine, your next car will drive itself. And I think we're really at a stage now where technology is a great tool for us and can really help us save lives, time and money. Well, a lot's happened since 2009. In the last really 4 years, there's been many changes, and many of us are grappling with those, whether they're technology changes, policy changes, new structural changes, design changes, even generational changes. We briefly discussed this, and I think as we look at communication technology trends, one of the, I'm not sure if you're able to see my mouse on my screen, but one of the things that we've noticed is that the smartphones have had an exponential rise, particularly since about 2009. And these are mobile computing devices that are now being harnessed throughout the navigation devices in vehicles. This is a very compelling, as we look at that 2009 point, this red area here is smartphone navigation devices, huge. The blue is dedicated portable, and the orange is factory fitted. And what we've seen is a real explosion in the use of new technologies as navigation tools. And clearly at the same time, we're also seeing these same new technologies being used by young drivers as a distraction tool. So I think our focus is how can we harness technology to be a navigation device to assist in safety and prevent them from being a distracting device. And just looking at this chart here, the bars to the left of each column are the lower incomes, the bars to the right are the higher incomes by ages 18 to 24 through to 65 plus. And what we can see is these new technologies are in the hands of the young folks who we know from all our data. You're more likely to crash an ambulance if you're under 25. All the at-risk age groups are very familiar with these technologies. So this is really an opportunity as well as a challenge. Here we have a group of people who are very familiar with technologies that can be harnessed. And I think those of us who are in a management role are very familiar with the challenges of dealing with different generations. And I am not of the Y generation, and really I think it's very important that we harness these tools and these generations of folks who are very familiar with these tools to improve the safety of our system. Now, this presentation is the first presentation we've ever given from the National Academies that involves social media. I announced the hashtag as we opened. The hashtag for this particular presentation is hashtag EMS Fleet. And the cloud is global, so anyone in the world can be using that hashtag and sharing the information that's occurring during this presentation. I just want to spend a moment talking about the TRB and its mission before we launch into Nancy Ben-Dixon's overview of fleet safety technologies and fleet safety generally. So the TRB is the Transportation Research Board. It's a branch of the National Academies of Science, Medicine and Engineering. Very independent. It's to provide leadership in transportation innovation and progress through research and information exchange that's conducted within a setting that's objective, interdisciplinary and multimodal. The other issue is that EMS has a special role at the TRB. It's one of the 4 key E's: engineering, education, enforcement and emergency medical services. So there's much that the TRB can do for EMS and much that the EMS can do for TRB. The TRB produces documents that relate to EMS, and this is one such document, a guide for enhancing rural emergency medical services. And our subcommittee, the EMS subcommittee, its mission is bridging the gap between what we do and what is known. How can we enhance ambulance transport safety through shared knowledge of technical data? It's sort of a fragmentation panacea. There are so many different pieces to this puzzle of doing it the doing ambulance transport the best and most safe way. That the TRB EMS subcommittee is there to bring fragmented information into one place, uniting diverse disciplines and focusing on technically robust information. And if ever there was an excellent example of that in process, it was the example of our February 2012 summit. A full day of very robust technical information from a variety of presenters, all of which is available for public access, and tens of thousands of people from all over the world access that freely available information. Well, there's all sorts of information out there, and I had the privilege recently of not only being at Google but speaking at Google, and really having an opportunity to be at a mapping meeting there, where we're now in a situation where all sorts of mapping information is available. And in many ways, people say that, mapping is the new genre. Mapping is a powerful tool. We now have very integrated systems with mapping that integrate safety and economy. We have deployment systems, we have driver management systems, and we have intelligent transport systems. There's a bunch of management technologies. We're going to talk about a number of these today. You're going to get a more detailed discussion about the ASTEC Furno product, which is a comprehensive telematics and really an integrated vehicle intelligence system that does mapping and reports and hotspots. You're going to be hearing about Fleet Eyes. It's being used in Florida. And you're going to be hearing about Zoll systems, as well as a few words about the Telematics system, which is one of the few systems that runs pretty much off a simple smartphone without any vehicle hardware required. There are other systems out there that look at resource allocation and other systems used in other parts of the world. And these are some of the systems that are used in management of dispatch. This one's used actually in Florida and many other places around the United States. And again, we start to see the integration of smartphone clients and mobile tablets, things that we never saw 5 to 10 years ago, and technology-driven dispatching systems. And this is one system that's used actually, I think, in Norway. So the Transportation Research Board's been around since 1920, and it was an advisory board on highway research. I've actually found some very interesting documents that pertain specifically to ambulance safety from 1960 that involve the National Academies of Engineering. We'll discuss later. And it's there to provide leadership, as we said earlier. I think someone's mic's open. I hear a little background noise there. The TRB is divided into a number of divisions. I'm not going to extensive detail right now. And it has some special programs and also is involved in a major transportation database. And clearly is an opportunity for us to advance the research agenda for emergency services as well. I think, Nancy, your microphone might be open. I'm getting some feedback there. Yeah.
I was muted.
Oh, well, you're open now. Yeah, if you could just, somebody could mute their microphone. We're getting a little feedback. Thanks. Okay, I'm not going to go into all the details of the different research programs, but there are a number of different research programs. We are clearly more focused towards the highway and also to some degree some of the aviation. There's some very active aviation programs within the National Academies and as well as the Strategic Highway Research Program. And as I said earlier, there's the 4 dimensions of which we are fundamental. So the TRB's mission is as we've described it, and in many ways what the TRB's goals are mesh totally with what EMS does, being prepared for challenges, to conduct and promote knowledge, provide timely and informed advice, act as an effective impartial forum, promote collaboration, contribute to professional development, conduct and promote communications efforts, to contribute to public's understanding and a resource to the nation. And you can see many areas there that are totally relevant to what EMS does and how we do what we do in the best possible way. So we're a subcommittee under the umbrella of the Transportation Safety Management Committee, which is a bit of an incubator committee that, and there's even some discussions underway now that we may become a group, a self-freestanding group within the next few years. Welcome, Charlene Cobb. Pleased to see you here. I do have your slides loaded on the computer, so you'll be hearing from Charlene shortly. The committee's been established since 2007. It's a young committee. It's chaired by myself, Nadine Levick, and co-chaired by Eileen Fraser. It has a structure to it, and we're always open to additional people to help carry the water on this one. And our key focus is, along with the focus of the TRB, to address all these different elements. Because, welcome Neil, it's very important that when looking at an emergency medical transportation system, that all these different elements are addressed, and these are the sorts of elements that are focused on under the umbrella of the TRB. And I think the other issue is that there are many numerous and variably sound, interesting should be there, Neil, technically sophisticated events occurring sporadically on ambulance safety, and none are under a transportation umbrella, and that's why I bring you back to this slide. This is such an ideal home, so we can help bring all the different fragmented pieces into one productive interface. So that's our mission, and that's what we're here to do today. So as I said, we're here to integrate, to be an independent platform, to bring fragmented information together, unite diverse disciplines, and focus on technically robust information. And no better illustration of this do I have than this particular cartoon, which was actually shared at the recent TRB meeting. And I think this really highlights that we all have different skills, but we somehow rather have to use all those different skills to have the best and same outcome, to optimize the effectiveness, efficiency and safety of the EMS system. And you know, clearly some of us have better skills than others. Clearly the monkey's going to do a great job of climbing the tree, but there are many other parts to EMS that aren't transportation related in their development and background. And it's important that we make sure that whatever information we put together, that it's interpretable by all. Transport safety is complex. It involves a lot of different elements, as we've already outlined. And as we've said, medical error can kill a patient, but an EMS crash can kill all those involved and wipe out a rural EMS system and negatively impact the region's response capacity. We do have a significant burden that we are trying to address. 2/3 of the fatalities are actually occupants of the other car or pedestrians. There's a fatality each week involving an ambulance, and this is one of the highest crash rates per vehicle and per mile travel. There's a number of exemptions that make it a little more complex comparing this fleet to, say, commercial fleets, and Nancy's going to talk a bit about that. But basically in the United States, there are more safety standards for moving cattle than there are for moving patients. Now, I said right at the start that we're now in a new era, and we're in an era where there are social media tools. I am certain that the increased access to this information and interest in this information has been, in part, a result of social media activity. The hashtag for this particular discussion is hashtag EMS Fleet, and those of you who are familiar with tweeting, please feel free to use that tweet for the remainder of this presentation, which goes through till 3 p.m. Eastern USA time, and by all means use the hashtag AMB105. I'll be honest with you, exactly this time last year I had no idea what a hashtag was, but I now find this an incredibly valuable tool for sharing EMS information broadly throughout the EMS community, nationally and internationally. And we've also, as you saw on the opening slide, used an e-tag. It actually is a Microsoft e-tag, and that e-tag will take you to information that we're about to discuss. And that's the subcommittee info e-tag, and it'll take you to our subcommittee page, which is currently parked at that site. And that's what that page looks like, and you can sign up to be involved in the subcommittee from that page. So, fleet management approaches. Well, there's a whole stack that we talked about, and we discussed these briefly in our summit in February last year, and that e-tag will take your smartphone directly to that brief audio track. We talked a bit about a number of products, and we're going to cover those shortly. Hardware in the vehicle, data management and analytics, identifying safety performance levels and benchmarking, and different events and behaviours that can be monitored. Another system we've briefly discussed, and this one doesn't require hardware in the vehicle, although it can use that, but it can operate purely off a smartphone and give you pretty sophisticated driver behaviour and analytics, even though it doesn't require a hardware fit into the vehicle. And these technologies can be very valuable in an operation that doesn't have the capacity to outfit a fully developed hardware system. Another system that involves a spectrum of resources, we'll be hearing from Bruce Farr later in the presentation, who's going to be presenting some information from John Canane's region in Niagara in Canada. And these technologies here, again, are ways of optimizing the use of existing technologies to provide your service with a more efficient, a more cost-efficient and safer system. So, and again, there are other elements to this that can also use geofencing. As I said at the beginning, mapping is becoming the new nirvana. So, having done that introduction, and we're pretty much right on time, I would first like to open the microphone to anyone who has any questions about that brief introduction, and also I'd like to introduce our next speaker. I'm pleased to see we actually have participants not only from all over the country but internationally. Ronald Wolfson's joined us from Norway. So if anyone's got any questions about what we've covered, you know, it's very clear to me that a presentation like that just couldn't have been given 5 years ago because those technologies didn't exist. Charlene, welcome. I see you're joining us online on the computer interface. I have loaded your slides on my computer. If you wish, you can actually run them from your computer when it's time for you to speak. Here's our agenda. We'll be hearing from Nancy Bendixson first, a senior consultant at Aon in Minneapolis. Nancy's probably got more experience in managing fleets than any of us, and is very familiar with where the low-hanging fruit is and where the pitfalls are. Subsequent to Nancy, we'll be hearing from Bruce Farr, who's the Vice President of Operations at Orange, very experienced in EMS operations. Prior to that was, I think, Toronto, if I'm right, Toronto EMS. And Charlene Cobb is joining us from Sunstone, Florida. And I think Charlene's managed to jump out of the back of an ambulance and to find a computer somewhere and has joined us online and even has a microphone. Charlene, if you could just say a couple of words so I can see how your sound is, that would be great.
Hi, Nadine. Can you hear me?
Oh, you sound like you're sitting next to me. Fabulous.
Great. Okay, I'm going to mute myself.
Great. Okay, so over to Nancy Bendixson. I'm actually going to make Nancy Bendixson a presenter. So over to you, Nancy, and you should be able to share your screen. There we go.
Is that showing now?
Looks gorgeous. Mm-hmm.
All right. Okay. Well, thank you for having me. I am going to provide kind of the background here of the fact that I am not, why can't I advance my slides here? What's going on? What's going on here?
It didn't let you advance your slide. Use the page up and page down rather than the arrows. that's how I got around that. But if not, I can load my slides and see how we go.
Oh, there. Okay.
Yeah.
Did you?
I didn't do anything. But it looks like you got
All right. Whatever. I got it to go. Oh, there. Now I got it. Very good. Maybe it wasn't loaded all the way or something. All right.
Yeah.
Today you're going to be hearing about technology, and I wanted to kind of let you know that technology alone will not create the sustainable, effective fleet safety process that we need to have in order to protect your EMS people in the vehicles, the general public, your patients. Technology, I'm just amazed at all the things that Nadine has given a brief introduction on. It is rapidly changing. People ask me about the best system, and I go, I can't tell you. There's too many new things going on. But what it does provide for us is a wonderful way to be able to monitor on-road performance, where in the past it was via a ride day. It would be tracking hours of service with a paper record, documenting, boy, it looks like those brakes are getting a hard workout when the vehicle's been brought in for service, versus, you know, being able to really see this real time, provide some feedback to that driver that we can then hopefully start seeing better driving behaviors. And a little bit about me. I'm a safety consultant for an insurance broker specializing in fleet safety. I do a lot of work with a wide variety of vehicles, you know, ranging from the tractor trailers, a service van. I have a pretty major EMS client, and along with vans, passenger cars, all sorts of different things. But what I try to do is really be giving people the ideas that there are processes, safety management, things that we need to do in order to reduce our potential for serious losses that result when vehicles are not well managed. And that kind of takes me to the next slide here. Why do we want to manage your fleet? Well, it's still, and it has for well over 10 years, it's the leading cause of occupational fatalities across all industries in the U.S. Very much it has shown to be a likely cause of work-related fatality in EMS. It can be a major source of third-party liability costs if you have injuries or death to the patient that you're transporting, the general public, loss of reputation, all these types of things. It is a very far-reaching, that vehicle crash is very far-reaching. We have work comp injuries to your EMS operators that are in the vehicle. Why do we have crashes? Well, very often it has been shown that driver decisions is a major factor in why motor vehicle crashes occur. And that's where the use of technology is going to be a great way to maybe have a management team become aware of that improper driver decision. There's hopefully some feedback provided that will also change some of those behaviors out there. We can do better coaching. So I'm a firm believer with regard to fleet safety that employers do need to promote safe driving behavior and have good, strong fleet safety systems in place to be able to have something that's enforceable from a driver safety policy. When I talk about fleet safety management, basically what that means is we need to have a process in place for effective management of the vehicles, effective management of the people while driving. So then something else I like to talk about is fleet safety program. It's all those systems that are in place that permit a fleet to meet the assigned objective safely, cost-effectively, on schedule. The basic goal behind any fleet safety program is reducing the potential for motor vehicle crashes, protecting employee health, patient health, general public, and reduce the potential for property damage or injuries to the general public or customers. I wanted to kind of highlight to you what I feel are important measures of an effective fleet safety system. It's basically having fleet safety and operational practices that can be defended. We have a written policy. We need to have documentation that we've trained, that we've enforced, that this process is in place. I think technology is going to help show that implementation. Management accountability and controls. Loss prevention efforts that identify key loss drivers. Are our losses occurring at intersections? Are they occurring while backing? Let's focus your safety efforts on addressing those types of situations. And very important that that a management team be establishing an action plan that helps to control or reduce the risk factors that lead to our fleet losses. I do a lot of work with commercial vehicles, and in the past couple of years, Federal Motor Carrier Safety Administration has changed how they're evaluating their motor carriers. They have something called CSA, Comprehensive Safety Accountability. They're measuring an operation on how they are, what processes they have in place to make sure that the regulations are being implemented. So they have established this process called a safety management cycle, and I think it's very applicable to any type of fleet. Where do we start? You got to have your base policies and procedures, identify what are the responsibilities, roles. What are we doing from a driver selection standpoint, qualification, hiring, training, communication? How are we communicating what those policies, procedures, expectations are for a driver? How we monitor and track, and that's where I see the technology piece being so important, and meaningful action, being able to document to the Federal Motor Carrier Safety Administration, or even the if you're involved in a lawsuit, being able to demonstrate that we do in fact have a robust fleet safety effort underway. All right, when we're outside of the regulated type of vehicle situation, which EMS vehicles are not regulated by DOT, we have something called ANSI ASSC Z15.1. Originally, the first version came out in 2006. We just had an update in 2012. Basic elements are approximately the same. It's basically setting forth practices for safe operation of motor vehicles within an organization. It has definitions, the management leadership, operational environment. That could be things like distracted driving, fatigue driving. One new thing that they've added in the 2012 version is some information about distracted driving, as well as something called journey management, something that's been in place, say, in England. It's something that's very commonly used within the oil and gas production operations. It's a way to really be validating where is that journey going to be, what are the safety hazards, making people aware of those hazards, have a means for communication, so if somebody doesn't arrive on time, we can at least kind of know what their route is. And maybe in an EMS world, the routing applications, all those types of things kind of take the place of a journey management. Basically, you're trying to plan where and when our vehicles are going to be utilized. We need to think about what are the driver considerations, vehicle considerations, and then if we do have a loss occur, let's learn from that, do some analysis, and then making sure that management is aware of some of those issues there. When we think about some EMS-specific fleet safety processes, we can think about operating with due regard, basically thinking about the general public, making sure that anytime we're out there that we're thinking about beyond just what my EMS operation is, the impact I'm having on traffic around me. Seatbelts, making sure that we have people secured throughout the vehicle. Our equipment needs to be secured. What are we doing from the training, the processes or procedures we might have in place for dealing with intersections where we have a great majority of our very serious crashes occur? Do we tell people to stop and adhere to what the traffic device is? Are there situations where we say, nope, we have to go? We need to have our people that are operating our vehicles understand this. What kind of training have we had for our emergency vehicle operators? There's a number of them out there. We've got some newer ones that have been coming out. Nadine talked about it at a session that she had in January. Distracted driving, we have to think about, there are some, like the advent, the huge increase in the smartphones. Well, maybe there's one that's issued by the the EMS agency. Maybe many times people will have a private phone with them. We need to make sure that there is focused driving going on. We have a lot of communications. It's in-vehicle communication devices, cell phones, texting. We need to have some control process around that. Some of the things that I do when I'm working with clients is I'm evaluating people with how well have you taken some of those safe operating practices and implemented them within your operation. So I will take a look at, okay, what are the signs that I can see that you have good management support? What do you have in place for written operational policies? Can I see documentation that they are being enforced, that we're actually doing things like inspecting our vehicles on a daily basis? That's something that's mandated, say, in a commercial vehicle situation. Nadine and I were speaking at a seminar in Dallas a few years ago, and I asked the question, how often do we inspect the medical equipment that's on a ambulance? Probably several times a day. And I asked the question in a room of 350 people, how many times are we inspecting vehicles? I probably only had maybe less than 10% of the people in the room raise their hands that they were doing a documented daily vehicle inspection of their equipment, of the vehicle. We need to think about driver management. How are we selecting our people? What are the standards that we want to hire them to? What's an acceptable motor vehicle record? What age? What are the maybe driving experiences that we'll be looking for? How are we going to do some ride time with them to get them familiar with that equipment operation? How are we managing, how we're dispatching, that journey management? Driver training and communication, very critical way of you saying, this is the standards I have for driving safety. This is our expectations of how you will be behaving on that roadway. And without that, we have a lot of breakdown that can occur. So ongoing regular communication about fleet safety, driving safety is critical. Vehicle management. This is again where I say technology will help. Technology also helps from the driver management piece. But what's the condition? What's the maintenance? Do we have the best type of vehicle suited for how we're going to be using it? Then do we have a good, strong, robust process in place for the incident reporting, how we're investigating, how we're communicating, and then do we do some things as far as evaluating our performance? We can have all the great records or policies in the world, but if we're really not taking a good hard look once in a while going, boy, we really need to work better at ensuring that our driver selection standard practices are adhered to, or that we're doing vehicle maintenance, or that we're doing training, we lose, the program will lose the effectiveness at that point. So here's some of my thoughts on a path to a sustainable fleet safety system. We need to make sure that we implement the policies, procedures, the processes to help us have a good, strong fleet safety process in place there. We need to make sure that we are utilizing people in the field to provide feedback, to assist with implementation, not just having it be somebody at the corporate level or management level, but we need to get drivers involved in the process to measure performance to the systems. And what better way to measure than with the advent of the very sophisticated technology tools that we have available. The long run, your result should be a sustainable fleet safety process that has management accountability built into it, and in the long run you should see a major reduction in vehicle crash severity and hopefully frequency. So in summary, I want to have you guys be able to get to the real experts in technology. I'm more the, down on the ground fleet safety process implementation, management level types of things, but your next steps would probably be evaluate your level of fleet safety management systems in your service. Think about things like fatigue management, driver fitness, focused driving. Some strategies: increase the focus on fleet safety to the same level that you have for patient and employee safety. Some ideas for solutions: maybe you can do some audits, perception survey to think about, we have all these processes in place, what's really being used, what's the true thinking of the people that are, out in the front lines there of how something is working for us, education, and then finally use of technology. All right, that is what I had prepared.
Thank you very much, Nancy. Mary, would you be able to just post up our transition slide for a moment? The one, well, I can probably post that up. I think Nancy has to turn me back into a presenter.
Who is Nadine? I'm going to give you back
give me
as
back
presenter.
the microphone. There we go. And
then I'm going to mute.
Sounds good. Let me just see if I can get the screen to go to where I want it to go. There we go. And okay, actually, Nancy, I'm going to get you to keep your microphone open for a moment. And I think at some point I did mention the double-edged sword, that we've always got that challenge of in-vehicle fleet telematics and tools could be a distraction. And I think the real challenge is how to best design the in-vehicle fleet management tools so that they not only are not a distraction but actually assist in safety. Nancy, I well recall you making some very valuable comments at the summit that we had 12 months ago on the issue of distracted driving. And I was just wondering if you'd be able to remind us of some of those numbers. I think you had some very compelling numbers that pertained to use of cell phone and use of texting. And I just want this audience to be very familiar with that. Would you mind carrying us through some of those tips? I found them very compelling and valuable.
Sure. All right. I can just kind of talk through it here. Sure. Distracted driving is any activity that can divert a person's attention away from the primary task of driving. Just using a cell phone delays reaction time as if you had a 0.08 blood alcohol concentration. It increases your crash chances by 4 times if you're using a handheld phone, and 23 times more by texting. When we think about distraction, visual, it takes your eyes off the road. Cognitive, takes your mind off the road. Manual, takes your hand off the wheel. Auditory, takes your focus off the road. All of, and maybe there's a task that might combine more than one of those types of categories into a, that makes up that distraction. So that's kind of an overview of some of the distraction types of things, but the location and how the in-vehicle technology input devices will be very important so it doesn't cause a problem. Is there a way maybe you can have who's ever, not necessarily the driver doing the input, but maybe the co-worker in the vehicle that could be riding next to the driver could be doing more of the input, or maybe it's less manual input or something like that. But anyway, so that it definitely is, the distraction piece of it is very critical.
Yeah, thanks, Nancy. I think they're very compelling numbers, and I think that I'll tell you right now, I don't text and drive. I will tell you that I did for a brief period. Not only were those numbers compelling, but I think anyone over the age of 45 who tries to text and drive is going to have some problems with their focal length. But those are astronomical increases in risk, a 23-fold increase in risk. It is just huge. And I think this, again, rests on that the initial cartoon slide that I put up, that we all have very diverse backgrounds, but each one of those diverse backgrounds is important. And the human factors issues in the approach to a number of these tools, I think, is key. clearly we don't yet have standards that guide and drive us for many aspects of this. It's, as you say, these are all very new tools, and like all things in technology, many of them are becoming cheaper, better, and faster in total conflict with the usual triangle of it can't be cheaper, better, and faster, but it is. So I think it's an interesting arena now, and it's a matter of some real focused interdisciplinary attention on how to best harness these tools. I think, Nancy, there's a little rustle on your microphone there. How to best harness these tools so that we are able to get the benefit of them and to ensure that the potential challenges with the use of them are addressed well in advance. I was just wondering at this point, before we embark on our case study presentations, if there are any questions from anyone in the audience about any of the material that you may have heard this afternoon.
Hi, Nadine. This is Charlene.
Yes, Charlene.
I really liked her idea of, rather than focusing so much on distracted driver, I liked her idea of focused driving. I think that that's a new key term that I'm going to be stealing and using.
It's all part of the R&D, rip off and duplicate.
Yeah,
exactly.
Yeah.
But that's how
I mean, it's, you know, I think it's very important to think about that, because we need to be focused. You know, we have a lot of duties that we're trying to do out there, but our most important mile, this is a little term I like to use, is our most important mile we drive is the mile ahead of us. So.
That's the one. You got it. But I think it is a very interesting, very interesting opportunity, and really we're incredibly grateful for Nancy to give her time to this seminar and to share these perspectives. I see many elements in the presentation Nancy's just given us that I think are not only relevant but key and fundamental to enhancing the effectiveness and the efficiency and safety of our EMS operations. Ronald, I was just wondering if you had any comments to make. I know that in Europe you do use different technologies than we have here. I think you've got a mute on your mic. Can I unmute you? Let me just unmute you. I think you've muted yourself. You're connected, but you look muted to me. But maybe I'll try that. Okay. For some reason, Ronald, I can't hear you. Your microphone appears to be turned off. So if you're speaking, I might get you to just type a message in the message box. There is a message box on your far right-hand side of your screen that you can type into. If Ronald doesn't have any questions for us, let's just move on. Neil, I was just wondering your thoughts so far, where we're heading as far as trying to be as comprehensive as we can. Clearly, this is not a presentation that could have been given even 5 years ago. You know, a number of these technologies were not where they are now, although some sort of did exist. So if we're right with questions, what I might do is move us to our next presentation. Now, Charlene's actually at work, and although I did have a second on the agenda, Charlene, would you prefer that I brought you forwards?
That would be fine, whatever you need, Nadine.
Oh, all right, because I know that both yourself and Bruce Farr are in a position where you're both operational today. If Charlene, if you're able to stay on until 2:30 to speak, that would be great, and I'll move forward as the agenda states with Bruce Farr from Canada, if that's okay with you. Let me just see if I can find the slides. Bruce, are you with us?
Yes, I am, Nadine.
Excellent. I'm just going to make you into a presenter. Can you see the screen on the computer?
Yes, I can.
Okay,
I'm not sure that's...
Just turned you into a presenter, and if we just wait just a brief moment, I'll allow it to load. It should allow you to share your desktop.
There we go. Can you see it?
Yeah, I think that's it. I think I've got, we'll move right ahead to the next slide, because I think I updated your slides, but the updated one hasn't appeared there, but that's okay. Next slide. There we go. So I'll just do a brief introduction for Bruce. Bruce has very generously offered to step in and assist us today. Bruce is very familiar with this particular region in Canada, but this presentation has been compiled by John Kinane, and John discussed some of this data with us very briefly at the summit 12 months ago. John is not quite available. I think he's out on a cruise in the middle of the ocean somewhere. And so Bruce Barr, who's now the Vice President of Operations at Orange in Canada, has stepped forward to assist us with this presentation. So again, Bruce, thank you very much for taking the time to do this. And it's over to you.
Well, thank you very much, Nadine. I appreciate that, that kind introduction. Good afternoon, everyone. As Nadine said, I'm currently working in the Orange Air Ambulance Service here in the province of Ontario after spending 40 years working at Toronto EMS. Toronto EMS, as you may know, is a very small service, does about 250,000 calls a year, launches about 100 ambulances into service each and every day, and I was very proud as the chief when I retired that out of all of those calls, we had about 2 major accidents with very few people injured on an annual basis. So I'm very pleased with the work that has gone on in safety, and of course Nadine has been leading all of us for a number of years, so we should all be grateful for that. Nadine said I'm kind of here on behalf of my colleague John Kinane, who's the chief of Niagara Region EMS. As you can see on the slide, their population is about 430,000. They cover 12 municipalities, Niagara Falls, of course, and it's about 1,850 square kilometers. Their call volume, 75,000 calls per year, and they drive about 2 million miles. At peak staffing, they operate about 26 vehicles. They do operate single-staff paramedic response vehicles to augment their advanced care transport unit fleet. They are a fairly busy service for that region of the province. And what I'm going to do is to try and take you through a bit of John's story from Niagara in terms of how they have brought about significant change in not only accidents but in vehicle performance through the use of the ACETEC Integrated Vehicle Intelligence System that you can see on this current slide. The picture that you're looking at, of course, is the black box technology that's installed to replace the major wiring components in a typical ambulance build. This is a fully integrated vehicle performance monitoring and control system with all of the onboard intelligence that goes along with it around safety systems being the kinds of things that we're talking about, which is driver safety, doors that may not be appropriately closed, staff on board the vehicle that might be unbelted in situations where they should be belted. And of course it includes Eco-Run, which is an idle management program, which I'll talk a little bit more about in a minute. And of course, it includes an asset protection module. Most of you may know a little bit about these kinds of programs in terms of protecting assets on board of an emergency vehicle. In the case of Niagara Region, they chose to tag 8 important items of equipment. Of course, the stretcher, the monitor defibrillator, the drug bag, the the spare oxygen tank, other vital pieces of equipment as seen by their service. Other services that do this, of course, have their own list, and that totally depends on your operation. Again, I can speak a little bit more about that. These integrated vehicle and intelligence systems are particularly important when you're dealing with safety, when you're dealing with the location of all of the vital pieces of equipment, and of course the reduction in the cost of operating and managing an emergency fleet. As you can see on the screen, speeding infractions, as I mentioned, when staff on board the vehicle may be unsecured. Compliance to lights and siren use on the data that I'll show you shortly. You can have a printout of you can print out specifically or have live on the screen the actual mapping where the vehicle has been at the completion of a call, so that you can review with the driver of the vehicle, if you want, the activity on the way to that particular call. And of course their compliance with the use of lights and siren, because it's indicated on the map exactly where they turned on their warning systems. In the case of Niagara region, as with many other services, these driver reports that can be created and printed off are used in reviewing staff performance, whether you're talking about their uniforms, whether you're talking about their patient care, whether you're talking about their attendance. In this case, you can now put before them some details regarding their specific capabilities as an emergency vehicle driver, and point out their good points, and of course in some cases their bad points. These systems, the technology that ACE-Tech has built into them, allow you as the service operator to predetermine the types of speeds that you want your staff operating at. We have a number of services in Canada that have gone so far as to say to staff, under no circumstances do we want you driving any more than, say, 10 or 20 kilometers above the posted speed limit. And of course, as we can all appreciate, the message is to staff, it's important to us as a service that you get through your shift, you get through your day with you and your partner and your patients, and you get home safely at the end of the shift. So all of this is to create the environment of safety first in the organization, and of course this type of real-time data helps you as the service operator to maintain control over the staff and to provide that really important feedback. Of course, the future for ACE-Tech systems is really exciting, because we're looking at putting forward-facing, rear-facing cameras, as well as a camera on board the vehicle, which can be replayed in the event of an incident, very similar to what they're using in buses these days. This particular graph is pretty important. When you look from left to right, you see the drop in the 135 kilometer range of speeding. You see that drop significantly in July. I appreciate there's 2 Julys up there. The first July that you're looking at from left to right is July 2011, and then the next year is through to July 2012. Up to that point, Niagara EMS was using a system that presented them with data. However, it wasn't real-time data, and it wasn't sophisticated to the point where they could watch it real-time from their desktops and get immediate print-offs, have things like alerts When staff are speeding, you can have an alert through the AceTech system sent to your pager or to your desktop indicating that there's that Bruce, he's speeding again. So that you can see in July and August of 2011 is where we saw a major reduction from some 500 infractions over the 135-kilometer speed down to the 200 range. And you can see since then, with the improved capability using this fully integrated system of real-time driver data, and by sharing it with not only our frontline supervisors, but all of the paramedics in the workforce as well, we've been able to maintain our speeds well below where they were previous to that. And of course, again, reliable data in a real-time environment, coupled with the fact that, we tell staff about the importance of safety first, we've come a long way. We're very pleased with that. Of course, part of this technology, as I said, is reducing the ability to reduce idle times by as much as 40%, to lower your fuel consumption and your overall costs relative to vehicle operation. This also reduces carbon emissions, which contributes to a greener environment. And I think, as Nadine knows, in Europe, services are actually turning carbon emissions into dollars, and that's how they budget, and that's also how they receive money from their federal governments in terms of fuel savings. And I'm not sure about the United States, but I can tell you that the Canadian federal government is looking at a similar program so that everyone that operates in an emergency vehicle environment is looking at the importance of being able to reduce carbon emissions. This kind of technology also allows us to prevent issues with battery management because, again, we can have real-time view of the vehicle's performance. Our fleet people in Toronto EMS, as an example, know that an operations vehicle out in the field at any particular moment will have an issue with its battery before the actual driver of the vehicle will know. All of this can help us to reduce our engine wear and reduce our overall maintenance costs while extending our vehicle life and engine life. Monitoring the driver's ability to maintain appropriate control of the vehicle, so that we're, I've noted here reducing excessive RPM, but that's only part of it. It's the jackrabbit starts, the hard on the brake stops, the hard turning, left and right turning, all of those things that present additional wear and tear on the vehicle is all part of the AceTech monitoring system. When we talk about idling period, this particular slide shows 5 of the older vehicles in the Niagara fleet that did not have the eco system at the time, but it does have the ABI system, which provides all of the data. So what you see here on the left-hand side, aside from the vehicle numbers, is the number of excessive idles for this particular list of vehicles. An excessive idle, you can set that, but most services in Canada are considering excessive idling anything over 3 minutes. And so you can see in the next column the idle duration, the amount of time that vehicle has idled. This report is for 1 week, by the way. You can see the fuel that was consumed during that period of idling and the cost to the service. And had these vehicles been equipped with the EcoRun system, and EcoRun, for those of you that aren't aware of it, operates on the vehicle and is driven by 2 sensors. 1, the temperature in the patient compartment, and 2, the status of the electrical system of the vehicle. So when it's in a reduced voltage mode, it automatically starts the vehicle. If the temperature in the patient compartment either swings too hot or too cold, depending on the time of the year and how you have it set, again, it will start the vehicle. But when we're talking about fuel savings, we all know that our vehicles, whether they're on an emergency scene or whether they're sitting outside of hospitals or bases, staff want to keep them warm and cozy, and we want the staff to be warm and cozy, but excessive idling is a very expensive concern for those of us running services. So you can see in this particular 5 vehicles, while $77 may seem low, when you're looking at return of investment, that's not a bad figure at all. And in Niagara's service, they're up around the 30 to 40% range in terms of savings on a regular basis. Again, while we don't measure it now, you can see the rating of almost 270 pounds on carbon output that was saved. So in summary, the ACETEC AVI, or the Automatic Vehicle Informatics System, has a long list of benefits. I've simply demonstrated for you where Niagara EMS is focused in the areas of driver safety, which includes driver education in the long run, and their ability to protect assets, and their ability to reduce their costs around idling. So protecting assets with theft protection, something called geofencing. When you have this kind of technology, you can go into your computer system. You could, say, geofence a hospital so that you would know when a vehicle has arrived at a hospital. You'll get a timestamp on your computer. If you have specific vehicles that you don't want to go outside of any particular territory within your service district, you geofence that territory, and if that vehicle was to cross the line, you would be notified on your computer. You could have it sent to your PDA, your cell phone, or whatever. Reducing engine wear and reducing maintenance costs, again, while extending the vehicle's life and operating performance. I think the one for me is being able to modify driver behaviors by presenting them with real-time information and a full suite of reports, and in particular the ability to update them when their driving isn't good, and that's for me, that comes in real time, and you're able to provide that shift-by-shift feedback to your paramedics. Improving fleet efficiency and your overall operations by having this type of data available, whether it's to prevent accidents or whether it's to reduce your costs as a service operator, I think is, it used to be something that we consider for the future, and now through this kind of technology that's available with the ACETEC system that's widely used here in Ontario, all of this is available to us right now. It's available from the moment you install this black box technology. And of course the ability to be able to track information through web-based interface, as I said, immediately upon the installation of this kind of product, I think builds excitement amongst the service staff to see that, we're really focusing on performance, we're focusing on cost reduction, we're focusing on the health and safety of all of our staff and the communities that we serve, but more importantly, we're sharing the information, and we all know that information is powerful. This is one way to share it with everyone on the team. So unless there's questions, Nadine, I think that kind of wraps it up for me.
Okay. Well, thank you very much. That's really, really valuable insight into the way that your service has, let me just see if I can get us back to our original slide, the way your service has actually utilized that technology.
Do you have the control back?
I don't think it came back to me yet. That's the problem. I think you have to give it back to me. It's a very civilized interface, this. It requires you to actually give it back to me. I don't think I can take it back. Request. I can ask for it. There you go. I'll ask for it.
There you go.
There we go. Oh, there we go. Back to our site. I'm happy now. Oh, there's AJ again. All right. So here we are back at EMS today. Here in, by the way, Washington D.C. Just so you know, is like a ghost town today. They're expecting actually within the next hour a very violent blizzard to strike the city. And all government buildings are shut. And in actual fact, even though you see Rick Payne there, he's probably the only person that said to it at the moment. And he went in there on this day to make sure it was possible for us to do this. So I did want to express my thanks to the National Academies and particularly to Rick Payne and Mary Kissy, who are operating the interface for us and making it possible for us to do this today. So thank you very much. I shudder to think what your drive or your travel home will be this afternoon when we're done. Do any folks have any questions? And there will maybe some questions as we wrap up. I think terms like geofencing and again getting back to the mapping that we began with, the value of mapping. It's now we all know that Google is one of the most ever-present and powerful organizations, built primarily on their incredible skill at mapping and sharing mapping. And I just want to share with you a small vignette when I was at the Google office attending a mapping meeting in New York in the last couple of weeks. And it was actually a meeting of mappers at Google, so many of the people in the audience were not familiar with the technologies that so many young people are using, and many of the people in the audience did not even have a smartphone. And one gentleman got up and he said, look, I've been mapping all my life, and I don't own a smartphone, he said. And he said, but every now and then when I need to go somewhere, I open Google Maps. And he said, it's very interesting, but I noticed that on Google Maps you have numerous restaurants marked on the maps. There are about 200 people in the Google office, very interesting place to be, and head office, and there was a silence at the end of that question, and he said, so tell me, how do you get the restaurants on the maps? And there was this sort of silence generally, and one of the four Google giants sitting at the panel at the front quietly said, we bought Zagat. And it was that moment that I sort of realized that, you know, what we know as mapping, and that was a presentation, by the way, about the role of Google and the Google Health and Public Safety group, their role during Hurricane Sandy, and some of the very impressive mapping tools that they use to help the public, be it finding an open gas station or assisting in evacuations. So I think when we start using terms like geofencing and we start to look at what we can do today, one of the things that intrigues me is what can we do tomorrow? Given what we've seen happen since 2009, and looking at what we can do now and wondering what it is that we're going to do in the future, I think the sorts of tools that we're seeing now, as powerful as they are in their infancy. So if there are any questions, I'd take some now. Of course, I'm dying to ask some questions about not so much the technology, but the issues we touched on just as we began, the diverse generational and societal issues. Now, here we are implementing technologies that didn't exist 5 or 10 years ago, and how can we best prepare ourselves? And I'll be throwing some questions to you all regarding how do we prepare ourselves for change, and how do we make it as smooth as possible to implement change to enhance what we do. And so I'd like you to be thinking about those questions, because I will be posing those. I don't want to delay Charlene. I know that she's operational today, and I'm very grateful that she's joining us. So without any further ado, I'm going to pass the, now let me see, I'm going to try and upload Charlene's slides. Are you at a computer, Charlene?
Yes, I am, Nadine.
And let me just...
Actually, I have a iPad.
You have an iPad. Well, I'm very impressed. So we we now have a presentation being participated. I'm just going to see if I can bring your slides up, Charlene. One moment. That's AJ you can see sitting there. And I do have your slides here, Charlene. So I think that we should be good. You should be able to see that. Is that you good there, Charlene? Can you see that slide? Is that your first slide?
Yes, perfect.
You can actually see it? I wonder if you can forward them. I'll forward them. You just say next slide. That might be easiest. I'm not sure about the iPad in this system. So
Okay.
I'd just like to do a little brief introduction to Charlene. I've had the privilege of knowing Charlene for a few years through her involvement actually with the EMS Safety Foundation. And I must admit, I don't think I've ever struck anyone who has, she's almost like a safety vigilante, who really reaches out to work out the best operational way to make safety work for her service. And she's a huge asset to Sunstar, and not only an asset to Sunstar, but a huge asset to EMS nationally. Charlene's been involved with a core team of folks with NAMT to develop and implement the NAMT EMS safety course. She's also spoken at the National Academies on a number of occasions at our TRB EMS Safety Subcommittee and summits, and we're indebted to her time and her effort that she's put in. And today Charlene is actually working clinically and has made it possible for her to have some time to share some of their experiences at Sunstar with putting in-vehicle telematics to use. So thank you so much. There's much more I could and should say, but I'll stop there in the interest of time. And it's over to you, Charlene. Would you like the next slide?
Not yet. I want to thank you, Nadine, for allowing me to speak today. And I appreciate all those nice things you said about me, and I only hope my boss were on here to be able to hear some of those things too.
It's
but you're
being
right,
recorded, don't worry.
I am very passionate about safety, and actually I just missed a call that I was supposed to go on for a heart transplant that was being taken at Tampa General, but that's okay. So now I have all the time in the world to speak. Okay, so today I'm going to be speaking to you about 3 different types of technology that are out there for EMS and that we are using at Sunstar. And I know that I use Sunstar a lot in my PowerPoints, but I'm very proud of all of the safety initiatives that they've done there, and I like to let everybody know about it. So we've got 3 different types of technology. The first one is front-end technology, which is the Marvelous system. The second one that I'll be speaking about is rear-end technology, which is the, or back-end technology, which is the fleet eyes. And I'll be talking about this more in depth as we go on. And then the last one, which will be retrospective technology, which we use, which is the road safety product, which both of the previous speakers talked a little bit about, but I want to go into it a little bit deeper to show you what we are doing with it at Sunstar. Okay, so you can turn the slide now. Thank you.
Hopefully.
Maybe.
There we go. You should be good now.
It didn't turn.
Oh, it's just because you're using an iPad.
Can I do it? I guess maybe I can do it.
I can make you a presenter, but I don't know if you can give me back. Okay. Let me. I did turn the slide. But can you see?
And just a little bit about this picture. This is not a photoshopped picture. This is all, well, actually, the flag is photoshopped, but all of those ambulances were actually brought in at the same time. So we're quite proud of that picture that we were able to get them all when we first started in Pinellas County all together. Okay, next slide.
I think there's a brief delay with the iPad. Yeah.
Okay, so basically, like I said before, we are using Marvelous as a front-end tool, meaning that we're using it to dispatch the right truck to the right location. Go ahead, next slide. So a little bit about Marvelous. Prior to this, we just basically used history and geography. We were used to placing the trucks in a central location throughout the county, where we knew that we had high call volume, basically through the history. But this didn't turn out to be very efficient. When we bought Marvelous about 10 years ago, or 8 years ago, we had about 10 years worth of data that they had collected from us, and they uploaded into the system. Well, they used that data and the data that we had been collecting and the data they had been collecting, and now, you know, we can basically tell which street corner the next call is going to be on, which really helps our crews a lot with the safety aspect as well. They can determine where there's a high traffic pattern in the county, where they should basically stay away from. And Marvelous basically uses all of this data that it's been collecting to forecast, much like a weather report. And as you can see on the map, it's kind of like the storms, where the storms are going to be each hour of the day. The red being the highest volume, the yellow not so heavy, and then the green is a light volume of the day. So the dispatchers can appropriately move the units to cover the areas that are going to have the highest call volumes at that time of day. And again, we're using the data for the past 10 years, plus we're using data from the past 365 days of the year, because we have a very fluctuating a volume here as far as snowbirds go. We have a lot of people that come down to our county. As a matter of fact, during the normal time of the year, the summer months, we're about 900,000. And then during the winter months, we move up to about 1.2 to 1.3 million people. Next slide. So with the utilization of Marvelous, as you can see there, we talk about it improving the response times. You can see how we've determined where to place our apparatus by the storm there, and all of those numbers are actually the units that we have there in the county. The darker purple area is where we need the most coverage at. We can take this into consideration when we're moving trucks from one coverage area to another, that if we know that we've got one high call volume area, we might want to move trucks through that area so that we can keep coverage there all the time. And then, of course, we can move trucks closer to it to fill the gap. A little bit about a background about Sunstar for you guys to know that I think is important to know. And with most public utility models, which we are fined $7 a minute for late calls, and we're fined $3 a minute for late non-emergency calls. And our contract states that we must be on the scene within 10 minutes 90% of the time. Non-emergencies is 20% of the time, or 20 minutes at 90% of the time. We must also be compliant in each fire district as well. So it's not just a matter of putting all of our trucks in the high call volume area. We've got to also put trucks into those outlying areas where they might be different fire districts. We strive for a higher average than 90%, of course. We usually average about 94 to 95% in our compliance. And we evaluate our post plan about every 3 to 6 months, depending on the season, to determine whether or not we have reasons to change it, such as road closures, construction, and then again, of course, the influx of citizens to our county. Next slide. So we have a pretty dynamic service area in that a single truck can get to most of the area that they are covering in 6 to 8 minutes, even though we have a 10-minute contractual obligation. we still realize there are problems without a chute, you know, getting in the unit, getting the unit running, and getting to the call. And then we have other issues that can also eat up our spare time. So this is not a true radius, but rather a very dynamic system that we run with Marvelous. Marvelous takes into account things like dead-end streets, traffic, geography, waterways. So as you can see on the map, a more realistic view of how a truck covers an area. So Marvelous has changed the way that we do business. You know, before we had to have more trucks on the road to cover the area, and now we're able to be more efficient and cover the area with less resources. Next slide. So any questions on Marvelous before I move on to the Fleet Eyes?
I just had one question about Marvelous.
Mm-hmm.
I was just wondering two things about it. How long have you had it in, and has there been much change to what it can do for you over the time you've had it?
We've had it in, I'd say, for about 8 years now. 7 or 8 years, I can't remember exactly when we put it in. And yes, it has changed the way that we do business. Like I said, we are able to do, you know, to handle the county much more efficiently with less resources. What was the other question that you had?
The third question was, has the capacity of what it can do for you changed over that 8 years?
Yeah, they're always making upgrades to it, but basically, no, the basics are still the same. I mean, there's some upgrades, there's some faster technology that, you know, they've put in, but it's about the same.
Okay, thanks. That's actually helpful. Thank you.
We're going to move on to the Fleet Eyes, which again we call the back-end technology. This is another technology that we use, and once an ambulance is en route, this is helping it get the task completed. So go ahead and move on to the next slide. Okay, so Fleet Eyes is a functionality that we use to provide help, guidance, and safety to our crews, as well as it's helping our dispatchers keep watch over the flock, so to speak. You know, when we go out of town, before we weren't able to watch our unit once it got out of Pinellas County, but now with Fleet Eyes, our truck could be transporting up to North Carolina, and we're able to watch the truck the entire time, which is great for us. Some of the things that we like about Fleet Eyes is that it can give us weather in the county, as shown on the map as well. That little green spot there where the arrow is facing is some showers that are coming into the area. That's kind of nice for us because we can now know where crews are going to be delayed due to storms, where they're going to have to slow down at. It's going to let the crews know, you know, what's up ahead when Miss, what was the lady's name that was speaking before? She was talking about the most important mile that you drive is the one in front of you. Well, when heavy weather hits in Florida, she's not kidding there. So this is some information that we can use to alert our crews with. It also gives us traffic reports and lets us know how the traffic is moving on a particular road. So we can see that if there's a red line on the road, that we can advise our crews, you don't want to take that road, you might want to move up to another area instead due to the fact that there's heavy traffic. The roads will show red, yellow, and green depending on the traffic levels, much like your GPS in your car now. We can also see what speed our unit is going and in real time. So that's definitely helping us with driver safety. If one of our dispatchers zeroes in on a truck and sees that they're going 70 miles an hour and on a road that he knows is a 40-mile-an-hour speed zone, in real time we can affect it as opposed to road safety, which is, again, retrospective, and I'll be talking about that a little bit later. Let's see, what else can we do with this? My crews can check in with us every half an hour when they leave the county, but basically we can also watch them with the Fleet Eyes. And if they have an emergency or a breakdown, this is where it comes in real interesting when they're out of town. It also shows us which the closest hospitals, fire departments, gas stations, and police departments are to that truck, so that whatever resource that we need, we can call immediately, and the phone numbers for those usually. And it saves a lot of time for our dispatchers also because, again, they can just click on the location of a truck and be able to have the resources that they need to them immediately. Next slide. So as Bruce was talking about earlier with geofencing, with his product, Fleet Eyes does geofencing for us too, and this is a technology that's been out now for a little while that's helping us to know when a unit arrives in an area or when it leaves an area. So we have geofencing set up to alert us if the crew is a half a mile outside of their post area. So if we have a crew that is tending to wander a little bit when they're supposed to be at post, we're going to be able to see that. We also have it set up at each hospital so that it can show when the unit enters the perimeters that we've established for them. We know that a crew is at a hospital. We can put that in the computer if they forget to advise, which also helps us to reduce our fines in the county. We can also launch Fleet Eyes over Google Earth, and you were talking about that a little bit earlier, Nadine. That's become a really nice product for us as well, the Google Earth maps, because we can look at that and see exactly where the unit is in real time, and we also use it to reconstruct the route that they took when we're looking at a crew that's had a late call. Every day at Sunstar, we have a pulse process where we look at the day before and we look at all the information that's available to us to find out why that unit was late to that call, whether it was a dispatch problem, a breakdown, or just a lost truck. People didn't route it real well. And then we can actually look at the Google bubbles, we call them, which comes up through Fleet Eyes, and it shows us the route that the crew took and how many times the crew went down a certain road and how many times they backed around. So that's a really good technology for us to use. Let's see. Next slide. And actually, I was just talking about that. So here's our Google bubble, so it can show us the route that the crew took. The green is when we are in compliance. The yellow, it means that we're in the last 5 minutes before we're supposed to be at the call, and then the red means we're now late for the call. So we can see where the crew went wrong. It looks here on this specific call that they had a poor out-of-chute time. They had a couple of minutes that they were moving around a parking lot before they could actually get out onto the major roadway and then to the call. Most of the calls that we're late on are just within under 1 minute, so that means a lot to us when we can show the crews this in real time and say, hey, you know, you had a problem with your out-of-chute time and therefore we were late on this call. It kind of gives them some ownership and helps us to be a little bit more compliant. Next slide. So it also gives us, like I said, the real-time tracking. The red line is showing us where the truck has come from and the truck at the point of where it is now. So if a truck is lost, we can start giving them appropriate routing. You know, so often before we had this type of technology, we would come up on the radio and say to the crew, you know, what is your location? What intersection are you at when they were lost? And we weren't even able to tell what direction they were going in. With this technology, we're able to see exactly where they are and exactly where they came from and what direction they're heading in, so that it really helps us to be able to help them find their way into the call. Next slide. So last, we can hover over a truck and we can see all of the details, such as the crew members that are on the unit, the speed, the heading, the incident information, and if they're transporting, what hospital they're going to, and the nature of the call. So if the dispatcher misses any information, he can click on the truck and it'll pull all of that up. Any questions on that technology? All right, we'll be moving on to the next slide, which is an overview of road safety. And this is the one that I was talking about, which is retrospective technology. This ambulance that's laying on its side here was a crash that we actually had back in, I think, 2003 or 2004. And when a picture tells the story here. When you think about that stretcher, if it's going to be staying put on the floor, where is that monitor going to go? This is a really great slide that I use in every one of our orientations so that the paramedic that's sitting in the back thinks about where the safest place is going to be for him once that unit does roll over. If we had somebody on the bench seat here, that stretcher and that monitor basically would have landed on top of them before tumbling to the floor. So again, it's a great story behind it. But a lot of times road safety is considered retrospective technology in the fact that we can't see what happened to the truck until it's finished, which is much different than with the Fleet Eyes and the Marvelous system. But it's a very good tool for training people about driving, and it also does give some real-time feedback to the crew. Next slide. So we use road safety data to look at accidents, to do accident investigation. We can pull the report on a unit to see how it was driven. On the left side, you see that it shows a summary of who was driving and the events that took place, such as the highest overspeed counts, time at idle, hard decelerations, etc. On the right side of the graph, we have three graphs that show the one is speed of the truck, the speed that the truck was going down to the quarter of a second, the RPMs, and then the lower graph shows whether they had their lights and sirens on, and if they were wearing their seatbelt, and how often they were using their brakes, if they were using their turn signals, and if they had a spotter if they were in reverse. We can also pull up the G-forces on the truck as well. And we use this technology quite often, like I said, when we're investigating a complaint about, say, how they approached an intersection or in a post-accident investigation. We can also see if they came to a complete stop at the intersection before the impact as well. Next slide. So we use monthly driver reports to identify high risk takers. We also post the report to have a little bit of peer pressure, help them to conform to our safety standards at Sunstar. And we use it with our employees on their biannual scorecards to provide information when we're doing their evaluations. So every employee has the opportunity to see their score every month. And typically, if they're behind that or below that red line there, a lot of people will give them flack for it, especially their paramedic. If they are the EMT driver that's in the front driving, their paramedic can come up to them and say, see, I told you that you were braking pretty hard. This reflects it here. And again, our employees really strive to be the best. And when they see their name up there and they're under the standard line, they actually have improved it themselves. Very rarely do I have to contact an employee and say, you've been below the line for 2 months in a row. Quite often they'll fix it themselves by the next month. Next slide. So when Nancy was talking before about measuring your successes, this is a tool that we use to measure our success and our safety at Sunstar. Here's a report that shows in 2006 we had a problem with backers or backing without a backer. And we started a safety backing campaign, and we were able to see how each step we took was working. It was getting better, and by January of 2011, we had less than 1,100 times a month or 36 times a day that our units were placed in reverse without having a backer. Now, that's pretty good, I'd have to say, when we have 70 units on the road at Sunstar during the day. So if they, and a lot of times that 36 times a day, they'd put it in reverse before the backer got out to push the backer button. So not bad considering that we have that large of a fleet on the road. I'm very proud of that. Next slide. So to summarize all of this, these technologies have definitely changed the way that we do business. We've realized dramatic changes in our drivers' attitude towards safety. It gave them, again, the real-time feedback of the audible tones that when they were doing something unsafe, such as, too hard a stop or too fast a turn, it gave them the audible tones. If they were backing without a backer, it gave them an audible tone. So real-time feedback as well as using this for all of the safety campaigns. And we have evidence-based data now to help us and to identify drivers that do not align with our mission and safety at Sunstar. And that's probably about it. Thank you very much, and if you have any questions.
Thank you very much, Charlene. That's extremely illustrative example of how to optimize the resources available in these diverse platforms. It's very interesting, if one were to do a survey of the 15,000 or so EMS services around the country and to see how many were actually using any technology of the different size services, I think it's impressive how your service has chosen to blend these three services, three systems. I suppose an interesting question is, as these types of systems change and become more comprehensive, it's going to be once you're used to using a system and it's implemented, just say one of the systems became comprehensive and did all three things in one platform. I imagine that's what's going to happen. I mean, I remember the days when I loved my Palm Pilot and loved my cell phone, and someone said, one day they're going to be two in the one thing. I said, oh, that's ridiculous. I like to look at my Palm Pilot while I talk on my cell phone. Little did I know what we were heading for. And I suppose there's two questions that do come to mind, and I think I might raise them now. One was a question we touched on briefly, and Ronald Rolfson did mention this in the chat section, and I touched on it before, is how are these systems being received by the crews? And we use the word crew very generically, yet we're very aware that there are really substantial generational changes between the 20-year-olds and the 50-year-olds. And so I suppose to either Bruce or Charlene, what do you see as the low-hanging fruit in making these types of new technologies optimally received by the crews across the spectrum of generations?
Well, personally, we teach it to them from day one. The day that they come, the first day they come into orientation, we tell them, all of the different things that we have out there, the different technologies we have out there that help them be safer and help us get them to the call to the patient's side quicker. Because they're raised with it from the time they come to Sunstar, we don't have any pushback really. The one thing that they did, most of them have said, is that they've worked in systems before that had the ICAM, and they weren't real happy about that. They felt that that was an invasion of their privacy. And so we haven't introduced ICAM yet, or any sort of camera in the cab of the ambulance. But I feel that we get a lot of information through these three technologies already that right now we don't necessarily need that. But you're right, Nadine. I can't wait till one day when, all of these technologies are one, much like an iPhone. So. Right.
Well, I think given what happened to my Palm Pilot and my brick cell phone, I think we well could be heading down that pathway. You do raise an interesting question, and I'll be interested if Nancy's still with us. I also am very aware that the carrot often works a lot better than the stick, and the issue of privacy and invasion of privacy and just feeling uncomfortable about being videotaped. It seems that you know, we've all seen the YouTube videos of people who made an error in judgment in the workplace, and if it was just a matter of the graph going up on YouTube, I'm sure it would be less problematic. But when you see their face and you see the physical environment. So is that Nancy going to be joining us to talk a little bit about some of the privacy protections? Over to you, Nancy.
Yes. Hi. Can everybody hear me? The drive cam, the smart drives, those types of things, I think if they are introduced with enough training that people understand, it really a lot of times can help protect them, because it can show. I've seen reviewed drive cam video that shows very clearly the EMS operator was not at fault. You can see a vehicle veering into their area from after they came off of an on-ramp into the ambulance space. And if there's enough of those types of things, it kind of becomes their ally in it. But I think a lot of it is how it's communicated, how the training, how the coaching is handled, whether or not people feel it's, how punitive is it, how, the invasion of privacy. I mean, it truly is, because it's viewing you, and it's going to record you when there's that hard G-force deceleration, or the hard brake, all those types of things, and it's but I think in the long run you can see a lot of the same types of improvements in, okay, we see the seatbelt use go up, we see the smoother driving going on, and all those types of things. But it takes somebody time to review all that video that comes in, taking appropriate action on it, and making it so it's a positive system instead of just a disciplinary process.
Yeah, I think actually, Nancy, you've raised a very important issue, and the issue that you've raised there is the the sort of manual reviewing of the video, and the whole concept of video archiving, and the administrative burden of that. I often think of those sort of systems sort of like buying the printer. The printer is cheap, but man, they kid you on the toner. And I think when
you're right.
Yeah, and I think when you're looking at a system, getting back to that slide with all the different disciplines, you really want to know that you're looking at all parts of the what is it really costing me to implement this. And there are many different ways to do it. One of the interesting quotes from the Telematics guys is, if I can give you a cost-efficient system that's not a burden to get the data from, that only gives you 80% of the data that you need, yet you can make the decisions you need to make on that 80%, well, why would you make an investment of a huge amount of money just to get the last 20% when it doesn't change your decision-making process? And I think that's where we start to get some very interesting questions. At what point, how do we look at this globally? How do we frame it so that we make sure that the operation, the service that's making the investment in whatever, is fully familiar with all elements. Yes, the initial cost, the running costs, issues relating to personal safety, issues relating to privacy. So I think there are many elements. Look, I don't want us to go over time. We have a few moments left, and I'd like to throw open the discussion if anyone has any further questions. I think we've been able to, in a pretty narrow window of time, I think if anyone sat and listened to this presentation series, they could pretty much feel confident they were up to speed with most of the conceptual approaches to what's out there and a number of the products, and also maybe even be prepared for what is it we might be dealing with in the future. And I think the future might be upon us before we know it. So I was just, yeah.
Hey, Dean, it's Bruce. Can I just add a comment to what Charlene was saying?
Yes, by all means, Bruce.
Certainly here in Canada, one of the issues for us is that people coming out of the community college system to become new paramedics are are typically very young, 19 to 21 or 23 years of age, and they've only ever driven the family car. And we spend a lot of time talking to them about, what they're about to get into as they go through their 2-year college education program to become a basic life support paramedic. And we really try to have them embrace this kind of technology as a tool for them to use and to work on, as I said, their safety and getting themselves home safely at the end of the shift. Prior to us doing this, we had a very high number of vehicle accidents with these people because all through their college career, they're told, speed is important, get to the patient, get them to the hospital, it's all important, and that's what they were thinking. And we all have, lots of stories about that in the past. So I think to really focus on them and have them embrace the technology has been part of our success. Thank you.
Thank you very much. Well, I think we're at a point now where I'd like to spend the last few minutes, first of all, thanking our speakers. I think we've had an opportunity today to really hear some outstanding cutting-edge, I think that might be a microphone rustling there, some outstanding and cutting-edge information. Just going to throw up our original slide there. And I wanted to thank all of our speakers, and I particularly want to thank AJ, who last year hosted our summit, and that's a photograph of AJ doing just that. I particularly want to thank EMS Today for making it possible for us to have a simulcast beamed from here and the Keck Centre, particularly under the less than clement conditions we have here in Washington today, and to have colleagues overseas as well join us. And I personally want to thank our speakers for making time possible to bring their wealth of information forward for others to share. I was just wondering if anyone had any final comments to add. I noticed that a couple of folks just also want to thank again Rick Payne for making this possible. I think the mere fact that we have a 2-hour session on fleet telematics for EMS is just wonderful, and I think this is really an area where we have much to learn and much to benefit from. We've got rapidly changing technologies. So without further ado, I'd like to thank everyone, and particularly want to thank Mary Kissy, who I just realised I need to make an organiser, but she's gone offline, so I can't. Okay. So welcome to all of those at EMS Today. We'll be sharing this information and these links with the folks online and at EMS Today. We'll be on site here until Saturday to let folks know about the work of the TRB and also the EMS Safety Foundation. And without further ado, that takes us to our wrap-up. So any final questions or comments before we close for the session? I think we're good. So thank you, Bruce Farr. Thank you, Charlene Cobb. Thank you particularly Nancy Bendixson and Aon and Rick Payne, Mary Kissy from the TRB. Particularly thank you to AJ Heitman for yet again making it possible for us to have a simulcast with EMS Today. So thank you, and I think we can now stop the recording. There we go.